We all must accept the challenge to lower population-wide risks associated with opioids. This means prescribing medication responsibly and looking at ways to use other medications for treatment of opiate use disorders. It also means humanely and effectively continuing to manage the pain and opiate medications of chronic pain patients who now find themselves sandwiched between yesterday's overprescribing trends and today's newer standards pushing for much less use. Any of us will become tolerant and increasingly physically dependent on any type of opioid if taken regularly. This can happen in a few weeks, or in some cases after just a few days of steady use. This is a well-known principle of opioids and human neurobiology that has been understood since the 70s and arguably much earlier in terms of centuries of experience with opium and then morphine. Many of us, in a much greater proportion than ever predicted or claimed by these manufacturers, will transition to chronic dependence on opiate medications. Even worse, many will then develop a severe opiate use disorder, aka opiate addiction, even following brief exposures to prescription opioids. This means taking the medications at higher than the prescribed amounts, combining them with other drugs and alcohol, and sourcing them ultimately from dealers and friends. The stories and anecdotes of young adults developing opiate addiction after wisdom teeth extractions or sports injuries are seemingly countless and have by now affected so many families, schools, and communities. The widespread and routine use, mainly of oxycodone and hydrocodone products, directly set the table for the current heroin and fentanyl epidemics. Illegal opioids, which are now widely available in nearly every county and corner of New York State. Thankfully, there are excellent treatments for opiate use disorders, principally methadone, buprenorphine, and naltrexone medications, as well as counseling. We all must continue to advocate and demand wide and expanded access to these medications in opiate treatment programs, other specialty addiction treatment centers, and in general medical settings, including primary care, where I work. The State Attorney General's Office has now for years aggressively enforced mental health and addiction parity standards, as well as New York State-specific opiate reforms, which call for easy access to these treatments with as few insurance barriers as possible. This has been particularly important to Medicaid patient populations who often lack the resources and power to otherwise fight for these treatments on their own. Thank you very much.